Have you ever seen a loved one's handshake when they're resting? Or did they shuffle across the floor when they walk? Well, these are a few symptoms associated with Parkinson's disease. Hi, I'm Bilal, and along with my group Louisa, Yashica, Jerlin, and Harmain, we're going to give a little insight about it. Parkinson's is a neurological movement disorder that affects approximately 4 per every 1,000 people. The hunt for more efficacious drugs to treat Parkinson's is on, and we're here to introduce you to one of the frontrunners. But first, what is Parkinson's? It's a progressive disease that has an adult onset, meaning it's more common as age. Parkinson's is a disease that kills certain cells in the brain known as dopamine-producing neurons, and are located in a place called the substantia nigra, which are two dark spots on each side of the midbrain. These neurons produce the hormone dopamine, which transmits signals from the midbrain to another part that controls movement, the motor cortex. Over time, this dark area of the brain gradually disappears and so do these dopamine-producing neurons. This impacts the movement of those suffering from Parkinson's as messages are able to be relayed. It can be thought of as a short circuit between the midbrain and motor cortex, with dopamine being the wires. The cause of Parkinson's is usually unknown in common cases, but can sometimes be caused by genetic mutations found in specific genes. Rarely, Parkinson's can be caused by toxic impurities found in recreational drugs and synthetic opioids. The risk factor for producing Parkinson's is wide and ranges from exposure to certain pesticides to the presence of gene variant.
Making an accurate diagnosis of Parkinson's disease can be challenging, especially in its early stages because no concrete test exists. Instead, a neurologist will diagnose you based on your previous medical history, signs and symptoms, and a neurological and physical exam. You must experience at least 2 of the following symptoms over a period of time for PD to be considered, including shaking or tremor, slowness of movement, muscle stiffness or rigidity, and trouble balancing with recent falling incidences. Once diagnosed with PD, your doctor will likely prescribe you with combination therapy of levodopa and carbidopa. While these are not curative, they can significantly improve the motor symptoms associated with the disease. As previously mentioned, PD is caused by a depletion of dopamine in neurons of the brain. Levodopa is the precursor to dopamine, which, unlike dopamine, can cross the blood-brain barrier and replenish neurological dopamine stores. However, on its own, levodopa produces gastrointestinal side effects such as nausea and vomiting. Carbidopa is added to reduce these side effects as it prevents the premature conversion of levodopa to dopamine in the bloodstream, allowing more to enter the brain and thereby reducing the dosage by up to 75%. While this current therapy has proved instrumental in reducing symptoms of PD in the short term, over time its efficacy is reduced as the body's ability to convert levodopa to dopamine decreases. This can cause a temporary reoccurrence of symptoms known as an off episode, which occurs sporadically throughout the day and can substantially reduce a person's quality of life. Although this can be compensated to a certain degree by increasing the dose, the extent of this is limited as high levels of levodopa can cause adverse side effects. For example, dyskinesia can cause erratic involuntary writhing movements, which for some people is more disabling than the disease itself. Use in the elderly and people with pre-existing psychiatric problems is also controversial because symptoms tend to worsen and can induce confusion, hallucinations, agitation, and psychosis. These effects vary depending on the on and off fluctuations of the treatment.
Nourianz is a newly developed drug for Parkinson's disease, bringing hope for you to halt the progression of your condition. Containing the active ingredient estradiol, it is a promising add-on medication to levodopa and carbidopa for off episodes, managing the recurrence of motoric symptoms. It is the first non-dopaminergic drug approved for Parkinson's disease by the FDA in the last 2 decades, approved in 2019, thus a major advancement. It is administered orally at 20 mg or 40 mg once daily. So how does it work? Estradiol is an adenosine A2A receptor antagonist to slow the deterioration of dopamine. Adenosine A2A receptors share location with dopaminergic D2 receptors, abundant in the striatum of the basal ganglia of the brain. These 2 receptors have opposing effects by antagonistic interaction that is balanced in normal functioning. To portray this with an analogy, dopamine functions like pressing down on the acceleration of a car, resulting in movement, while adenosine functions like applying the brake, slowing the movement. In Parkinson's disease, adenosine A2A receptors are overreactive and counteract dopaminergic D2 receptor function in the indirect pathway of neurons, depleting the transmission of dopamine. Therefore, as an adenosine A2A receptor antagonist, estradiol blocks the brain chemical adenosine to upregulate the signaling pathway of dopamine, subsequently improving motor function and reducing side effects such as dyskinesia in off episodes. Since 2001, over 25 clinical trials have tested the safety and efficacy in patients, demonstrating a significant decrease in off time compared to a placebo, where the drug didn't interfere with other drug pathways. In fact, Nourianz increased on time. Adding on Nourianz allows a lower dose of levodopa and carbidopa, minimizing risks of long-term resistance to original drugs, causing ineffective outcomes and side effects. Managing symptoms safely will improve your quality of life, providing aid to undertake basic daily activities and be less reliant on the help of others, due to the decreased risk of off episodes, benefiting work life and aspects of daily routines.
While Nourianz has its positives with lifestyle improvement, there are some risks and disadvantages which are worth noting. 4 double-blind placebo-controlled random trials evaluating the side effects of the different doses of Nourianz were conducted involving 734 Parkinson's disease patients. The most common side effect experienced was involuntary muscle movement, which has intensified or not been alleviated with the use of the drug. 17% of patients who were taking 40 milligrams of Nourianz experienced this side effect, as opposed to the 8% of patients who were taking the placebo. Psychotic and impulsive behaviors was a clinically significant adverse reaction which some patients may potentially be at a risk for when taking the drug. Patients with major psychotic disorders were recommended not to be treated with Nourianz, and if patients were to develop symptoms like hallucination and psychosis, dosage of the drug must be reduced or discontinued. Therefore, prescribers have been advised to inform patients and caregivers to recognize these behaviors and any changes. As this is a fairly new drug, more advanced in-depth research of long-term exposure is highly recommended to understand the true disadvantages of the drug.
Recently, the research has shifted focus towards a new treatment which targets the genetic causes of Parkinson's disease. It aims to explore gene therapy in the central nervous system using adeno-associated virus AAV. As mentioned before, the neurodegenerative process begins when the dopamine-producing neurons are gradually lost in the substantia nigra, which is a structure responsible for movement. However, by the time symptoms are expressed, significant changes in the connectivity and metabolism of the brain would have already occurred. As a result of this, the subthalamic nucleus, STN, which is a key regulator of the motor circuitry, becomes overactive. Previously, surgical interventions such as deep brain stimulation and lesioning have been successful in the STN. Therefore, it was considered as a suitable target for gene therapy. The gene therapy STN-AAV2-GAD is a surgical treatment which is comprised of a harmless AAV which transports the glutamate decarboxylase GAD gene responsible for producing GAD, a pivotal enzyme for the production of gamma-aminobutyric acid or GABA, which is the major suppressive messenger molecule in the brain. In a study conducted by Harmain and others in 2017, it was hypothesized that this local delivery of GAD gene in order to produce GAD and GABA would suppress some of the hyperactive STN neurons, which would aid in reducing the motor symptoms of Parkinson's disease. Results from this study reported that patients who received STN-AAV2-GAD gene therapy found it beneficial for at least a year.